If your blood test says WBC high, don't panic. In most cases, it's your immune system reacting to something. Let's break down what it can mean and what doctors usually check next. WBC stands for white blood cells, the cells that help your body fight infection and manage inflammation. A high result just means there are more of these cells in your blood than expected. Here are 3 common causes. Infection, especially if you have symptoms like fever, sore throat, cough, burning urine, or a painful area of inflammation. Inflammation or physical stress. This can include flare-ups of inflammatory conditions, recent surgery, smoking, severe pain, or even very intense exercise. Medicines, particularly steroids, can raise WBC. Some other treatments can affect the count too, so your medication list matters. The differential, most important next clue. What doctors often look at next is the WBC differential. Which type is high? Neutrophils high often points towards bacterial infection, inflammation, or steroid effect. Lymphocytes high can happen with many viral infections and other immune responses. Eosinophils high is more linked with allergies, asthma, eczema, and sometimes parasites or drug reactions. So it's not only the WBC number, it's which cells are high and whether it matches your symptoms. What clinicians check next? Next steps commonly include repeating the blood test to see if it's improving or rising, checking markers like CRP or other inflammation tests, looking at your symptoms, temperature, and exam findings, reviewing medications, smoking status, and recent illness. Sometimes they'll also check a urine test, chest symptoms, or other targeted tests depending on what's going on. Seek urgent medical help if you have persistent high fever, severe shortness of breath, chest pain, confusion, or if you have night sweats, unexplained weight loss, or you feel seriously unwell. For urgent advice, use NHS 111, and for emergencies, go to A&E. Recap: WBC high most often means infection or inflammation, then the differential helps narrow it down. If you want, I'll do the next video on neutrophils high versus lymphocytes high. Comment differential.